Good afternoon, and welcome to the Epilepsy Foundation of Connecticut webinar series. My name is Monica Anzalone, and I will be moderating today's webinar. For the purposes of sound quality, all participants have been put in listen-only mode. We welcome you to use the chat icon on the bottom of your screen to type any questions, and all questions will be answered at the end of today's presentation. Today's webinar will give a general overview on how to get started with Medicare. This will include a review of Medicare Part A and Part B eligibility for Social Security disability recipients. I would now like to introduce our speaker, Marianne Engengro. She is a native of Connecticut and has worked for many years in the insurance industry as an insurance broker. In 2016, she chose to open her own agency, Insurance Benefits Resource, where she works mainly with Connecticut's growing mature population. Marianne realizes the importance of education and regularly conducts educational seminars to help seniors understand the complexities of the insurance decisions facing them. She also volunteers her time in assisted living facilities, senior housing complexes, and nonprofit organizations, helping seniors navigate the ever-changing Medicare options. So I would now like to turn it over to Marianne. Thank you.
Thank you, Monica, and thank you all for having me. I'm so excited about this opportunity to help people understand the basics of Medicare. So today what we did is we took a very long presentation of slides, about 62, and we've kind of shortened it to about 11 slides so we can go over things in a timely fashion. Just to reiterate a little bit of what Monica said, I've been in the insurance business since the mid-1980s, and in 2006 decided to open up my own agency, and we have been fortunate enough to become an agency where we specialize in Medicare and helping people get onto Medicare, helping them understand, taking them through all their life transitions and changes from becoming eligible, retiring, and getting onto plans that most fit their needs and also be affordable. And today, so we're going to talk about some things. I just want to go over the agenda real quick. So we're going to go through what is Medicare and who is eligible, the agencies that are responsible for Medicare, the parts of Medicare, what your coverage choices are once you become eligible for Medicare, and the types of enrollments. So all that, and then when we're done with that, we're going to just touch a little bit on the process of going on Social Security disability and becoming eligible for Medicare at that point. And then maybe touching a little bit on some state programs that are eligible for low-income people and people on disability, and then we'll take some questions. So we're going to start with what is Medicare. And just real quick, Medicare currently provides health insurance for about 58 million United States citizens. So, it's a very large insurance program in the country. It is also federally administered, and it actually is insurance for 3 groups of people. Obviously, those who are 65 and older, people that are under 65 with certain disabilities, and then people of any age who have end-stage renal disease or ALS. There are the 2 parts of Medicare are offered to U.S. citizens or lawfully present citizens in the United States. So if you're a citizen or legal resident, the legal residents would have to be here in the United States for at least 5 years. There is also part of the Medicare that when they look at the disability, and we're going to go over this in some slides to come, that there are waiting periods for certain people with disabilities. So we'll go over that as well. And then the Medicare and You book that you're seeing over to the right-hand side. So that book there is sent out every fall to all Medicare beneficiaries and people who are new to Medicare. It's the official Medicare handbook, and it has all Medicare programs, which are updated every year. This book, you can either call Medicare and request them to mail it to you. You can download a copy on the Medicare website, and it will include all types of information about Medicare, the basics of Medicare, Medicare Advantage plans, Medicare Supplement plans, and also prescription drug plans. And it also does some comparison as well. Okay, so next, going on to the next slide. The Social Security Administration is responsible for enrolling in Medicare. And if you are a railroad retiree, then you would contact the Railroad Retirement Board, and they would be enrolling their retirees into Medicare. Both the Social Security Administration and the Railroad Retiree Board will collect premiums, and they'll also determine the amounts of premium for both Part A and B for the members. They also handle the replacement of Medicare cards. Now, Medicare is administered by the Centers for Medicare and Medicaid Services, which are better known as CMS, which we'll probably mention a few times throughout this presentation. There are 4 parts of Medicare, and Medicare does cover many different types of services, but the 4 parts are what we would start out with. Here's where we talk about our Medicare basics. So Part A is hospital insurance. It helps pay for inpatient hospital stays, skilled nursing facilities, home health care services, and hospice care. And Part B is our medical insurance, and that helps to cover medically necessary services like doctor visits, outpatient hospital care, outpatient surgeries, things like that. Part B also covers many preventative services, diagnostic testing, therapy, durable medical equipment, such as like wheelchairs, walkers, anything like that. Durable medical equipment can also be hospital beds, oxygen tanks, and things like that. Part A and B are normally referred to as original Medicare. And then we go to Part C, which is a Medicare Advantage plan. Medicare Advantage is another way to get Medicare benefits, where it combines your Part A and your Part B of Medicare, and sometimes and most times Part D, which is your prescription drug coverage. I call these all-in-one plans because they do cover all of the parts of Medicare, and then sometimes they cover more than what Medicare covers. They are exclusively insured and administered by private insurance companies that are approved by Medicare. And then there's Part D, which is prescription drug coverage. That helps pay for all outpatient prescription drugs. All right, so moving right along. There are 2 ways to get Medicare coverage. And one is the option 1, which is having original Medicare and coupling that with a Medicare supplement plan. And most of the time, because the original Medicare and the supplement plan do not cover prescription drugs, then you would have to also take out a Medicare prescription drug plan. So that would be one coverage option. Or the other option, option 2, would be to take out a Medicare Advantage plan, which is what we just reviewed, Part C of Medicare. And those plans could be either like an HMO plan, which is a health maintenance organization, or a preferred provider organization, which we call a PPO plan. And they cover Part A and B services and supplies. And most of the time they include Medicare prescription drug coverage. Medigap, or what we call Medicare supplement plans, will not work together with Medicare Advantage. Therefore, you cannot have both option 1 and option 2. They would have to be either one of those or one of those. Now, automatic enrollment. So if you're already collecting Social Security or railroad retirement benefits, as early as 4 months, at least 4 months before you're turning 65, then you'll automatically be enrolled in Part A and Part B without any additional application, or you won't have to call your Social Security office. You'll get your initial enrollment packet about 3 months before you turn 65, or 3 months before your 25th month on Social Security disability benefits. If you're not getting Social Security or railroad retiree benefits, then you must sign up manually, which we're going to go over in a couple of slides from now. Your Medicare card, which you'll receive with your enrollment packet. Okay, so now with the Medicare cards, and I'm just going to do a side note here, not to get too sidetracked, but as of April of 2018 and through April of 2019, Medicare is now distributing brand new Medicare cards. So anyone that may already be on Medicare will be receiving a new card if you haven't already. And if you can look at that card on the screen, the front part of the card, which is on the left side, the Medicare number, which we used to call Medicare claim number, is now a bunch of numbers and letters. It's no longer one's Social Security number. And they're doing this as part of a fraud prevention and identity theft prevention. So from now on, everyone will have a card with a new number on it, which they're probably not going to remember. So I do advise people to keep the card in their wallet, but definitely get it laminated. The Medicare card is going to act as your insurance card if you have that, if you choose to have that as your insurance. And it will have your name as it is in the system, the Medicare number, which will be a bunch of letters and numbers now, and then your effective dates for Part A and B. And again, if you have a Medicare card now, you with your Social Security number on it, you will be getting a new card within the next year. By April 2019, Medicare is expected to have everyone's card, Medicare card replaced with the new numbers. Okay, we talked about automatic enrollment, but this is if you are not automatically enrolled. This would mean if you're not getting Social Security or railroad retirement benefits at least 4 months before you're turning 65, then you'll need to sign up for Part A and B. Which you can do of so many different ways. You can either go to your local Social Security office and apply, you can go online and apply, or you can call your local Social Security office or the national number, which is on the screen, the 1-800-772-1213, which is our national number for Social Security. And they can also send forms out to you to have you do that on your own. So, and once you enroll, there are many different scenarios of how to do that and why you were not automatically enrolled. But the main thing is because you're not collecting Social Security or railroad retiree benefits. Now, as far as enrolling, there are many different types of enrollment periods. The first one would be your initial enrollment period. This means you're turning 65 and you're ready to enroll in Medicare. Your first opportunity with your initial enrollment period, it lasts 7 months. So how it works is that your coverage starts based on when you enroll. So if you enroll, and if you look at the graph, you'll see the first 3 months of your initial enrollment period before you turn 65, then your coverage will begin on the first of your birth month, your 65th birth month. If you enroll during your 65th birth month, then it will begin on the first of the following month. If you enroll in what we call the delayed enrollment process, which is delayed 2 to 3 months because it's after your 65th birth month, then your coverage will begin anywhere from 2 to 3 months after you turn 65. So for anyone that needs to enroll for Part B, it would be during either your initial enrollment period or a general enrollment period and some type of special enrollment period, which we're about to go over. But an important part here is if you do not enroll in Part B when you're first eligible to, and that could again be in many different scenarios, then you may have to pay a late enrollment penalty fee for the lifetime of your Part B enrollment. So that's very important to note. Now, we mentioned the initial enrollment period, but there are other enrollment periods, general enrollment period. So as I mentioned, if you don't sign up for Part B when you are first eligible for it, and you don't have a qualifying event to justify why you didn't enroll, then Medicare will ask you, or CMS will ask you that to have to wait to enroll between January 1st and March 31st of that following year. And then coverage will start on July 1st of that year. So let me give you an example. Say, for instance, you just decided you didn't want to enroll in Medicare for whatever reason, but you didn't have any other insurance or any type of qualifying event. And it's June, and June of 2018, and you decide you want to enroll in your Part B. You call up Social Security to enroll, and they say, well, you're out of your initial enrollment period. You haven't enrolled since when you were supposed to, so you're going to have to wait until January 1st of 2019, and you have between January 1st and March 31st of 2019 to enroll in your Part B, and you will not become effective until July 1st of 2019. So that's something that, you would have to be uninsured for a very long time. So we always want to make sure we know the rules of Medicare, we know when we're supposed to be, when we're eligible and when we're supposed to enroll, so we don't incur this. Because on top of waiting to enroll for almost a year, you're also going to pay a penalty. And that penalty will be a lifetime penalty. All right, so we're going to move on to the third enrollment period, which is called the special enrollment period. Now, this isn't, most people won't qualify for a special enrollment period, but they may be eligible due to many different scenarios, which I'm going to list a couple. Say, for instance, you're still working, you're 70 years old, and you finally decide to retire. And you've been on employer group insurance all this time, so you did not apply for Medicare. And when you go to apply for Medicare, you will be able to let them know that you had a qualifying event because you were employed and insured through your employer all this time. And what will happen there is when you're eligible and you enroll through the special election period, you will become effective the first of the following month once you apply. So it is important to note some things. So COBRA, which might be changing, but I'm not going to mention it yet because it hasn't, and retiree benefits aren't considered as active employment. So if you don't apply for Medicare within 8 months of losing your current employment or loss of coverage, whichever happens first, you may not be eligible for a special election period. Okay, so that is basically a very short description of getting started with Medicare. I do have some other information as far as some questions that were noted with Social Security disability that I'd like to go over. So let me just explain to you, when someone is on Social Security disability, you have to be on it for 24 months before you're eligible for Medicare. And like we kind of went over very briefly in the presentation, 24 months of Social Security disability, on the 25th month, you are automatically enrolled in Medicare. However, you have to be 18 years or older in order to be eligible for Medicare. If you are not 18 years or older and you're on Social Security disability, you will not be eligible for Medicare. The other program that we have is called the Medicare Savings Program. Not that we have, but it's it's state funded and some federal funding as well. It's called the Medicare Savings Program. We help our Medicare beneficiary clients get on that. It is strictly administered through the Department of Social Services here in the state of Connecticut. And as a courtesy to our new clients and existing clients, if we feel that there is an eligibility there, then we will introduce them to the program and we will help them apply for the program. Going forward, that program, again, is not an insurance plan, nor is it part of what we offer. We just help people get on it. And you would deal directly, once we help you apply for it, you will deal directly with the Department of Social Services going forward. So again, I tried to keep this as brief as possible so we can open this up to some questions. Monica, do you have any questions?
Yes, just looking at Medicare Part D that deals with prescription, a lot of people we understand that are on Medicare don't have prescription coverage, and so that's why they'll apply for Medicaid or a supplemental plan. So how do you become eligible for the Part D? How does that work?
Okay, now did you say a lot of them are not eligible for Medicare?
No, so typically, so Medicare Part A and Part B, they don't cover prescription, right?
Right, correct. That's also administered and insured exclusively through a private insurance company. So they would have to apply for it. So they have to be eligible for at least Part A and or Part B in order to get a prescription drug plan. If they want to get, and I know your question is based on prescription drugs, but just to know aside from that, that if they want a regular Medicare supplement plan or Medicare Advantage plan, they would have to have both Part A and B. But to get a prescription drug plan, they can only have Part A and or Part B. And they would just apply through they can apply through an insurance company.
Okay. And so Part B is separate though from Part A and Part B, and people would have to apply for that separately?
Absolutely. Anything, that's what we do here. We're an insurance broker, insurance agency, and specialize in Medicare insurance. So we do all those insurances. So the prescription drug plans would have to fill out an enrollment form, but first have to be eligible. And that's what we were going over today, is how to become eligible for Medicare so that you can move forward to get additional coverage, especially with prescription drug plans.
Okay. Well, that is helpful and certainly a good place to start, I think, for people, because as you mentioned, there is so much and it can be daunting, especially, at the beginning when this is something you're considering or having to consider. So.
Right. And if anyone is on Medicare, they should automatically be put onto a prescription drug plan.
Okay.
A lot of times, and they need to do that too because, they should automatically enroll themselves in, because by doing that, they're avoiding the late enrollment penalty for that as well, which we didn't get into all that. We can spend literally an hour to an hour and a half really going over all of the criteria for Medicare, but what I tried to do is just kind of tell everyone what it is, what it's about, how it's administered, and different parts of it, and when and how to enroll. But there are so many other things to know about this. So to answer your question, yes, they would have to enroll in a prescription drug plan and should enroll in a prescription drug plan as soon as they are eligible for Medicare, because if they don't, and they do it down the road, they're going to incur a late enrollment penalty fee for that as well.
Okay.
So these are things that, we can educate people on. There's a lot to know when you become eligible for Medicare, and really there's a lot to know before you become eligible for Medicare, like right before. What we do here is we'll also help people get onto Medicare or enroll in Medicare, we, kind of guide them through the steps. But it's important to know all these things so you avoid paying penalties in the future.
Okay.
Are there any other questions? I know you had some things you had mentioned about Social Security disability.
Well, I think that you generally touched on some of that towards the end, in that, people wait 25 months before they become eligible for Medicare if they're receiving disability. Mm-hmm. And then they're automatically enrolled, correct? It's not something that they have to separately apply for.
No, they automatically become enrolled as long as they're 18 years or older.
Okay.
Mm-hmm. Under their own Social Security number.
Okay.
And I know we talked about the Medicare Savings Program. I think I had mentioned to you I was going to go over some of the state-funded programs that we help people get on, and that's one of them, the Medicare Savings Program. That program is based on income. So we would have, there's 3 levels that we deal with, and if people are considering themselves low income or think they may be, they can also check with us, or they can call the Department of Social Services to see if they are eligible. It's always good to check, because I've had so many people come in here thinking, oh, I'm not eligible, and come to find out they were eligible, and it was a significant cost savings for them to to go on a program like that, becoming eligible for it.
Okay. And I think if people have further questions, I believe more can be learned even on the Social Security website, which would be ssa.gov. Is that correct?
Yes. Or and they don't have, they're going to have basics on there, and they can always call that the national number. I think, let me see, I have that. I can get that on the screen for them. Right here. So that 1-800-772-1213, that's the national number for Social Security. They also can call their local office. There's offices, in all over actually. So, depending on what area they're in, they can either go online to get the phone number for their local office.
Right. And I have directed people in that way as well, because I think not everyone understands that there are local offices. An example, here in Middletown, we have one right on Main Street that people can go into and even ask a question.
Yeah, absolutely.
Or over calling on the phone. So.
Yep, absolutely.
Yeah.
And when it comes to Social Security disability, any specific questions like that should be directed to Social Security.
Okay. And then, Marianne, your website, if people want to learn a little bit more about what you can offer and what you do as an insurance broker, what is your website address?
It's kind of long, and we're in the middle of changing things, but there's still information on there that they can get. It's www.insurancebenefitsresourcect.com. And that's all one word.
Okay.
Yeah, and there's quite a bit of information on there.
Well, great. Thank you so much for your time today. And for those of you who are listening, this has been recorded and will be available on our website at epilepsyct.com no later than the beginning of next week. So you can go listen again at your convenience, share with other people. So that will be available to you shortly. So we thank you, Marianne, for your time, and for those of you who have joined us today.
Well, thank you so much, Monica. I enjoyed every minute. It was great. Thank you.
Thank you.
Okay.
Bye.
Bye-bye.